I've been doing this for 14 years. I've worked with a lot of human trafficking victims over the years, and not a single one of them ever said, I'm a victim of human trafficking, I need help.
We know that trafficked individuals come in contact with the medical profession quite a bit through emergency rooms, clinics, OBGYN clinics, family practice, internal medicine. So we're on the front lines, but we're missing it.
The doctors knew that I was having sex with older men, and they knew that I was in multiple situations where I was beaten up, but they didn't put together that I was a trafficking victim.
There isn't an easy way to say, these are the 5 things that you need to be looking for, right? There are obviously clothing that is weather or situationally inappropriate.
Bruising or scars, burns, cuts, especially those in non-apparent places that may be hidden, repeated STD or pregnancy, fearful, anxious, or depressed mood. Certainly if the patient pays with cash and has no health care, that can be a warning sign. Patient may appear malnourished. A third party may speak in place of the patient and not allow the patient to speak. Substance addiction or the appearance of withdrawal of a substance can be telling. Frequently, patients will lie about their age. And the patient may also say that she's just visiting or passing through an area, and that should be cause for concern.
Trafficking victims are frequently tattooed with the name of their trafficker, or the trafficker has some kind of tag that's an identifying tag, so that if the victim tries to run away, she can be readily identified by other pimps as the property of her trafficker.
Just make sure you're paying as much attention as you can, because sometimes these girls are going through very difficult times and you would never know. And they want to speak out, but they're too scared.
I didn't really feel safe talking about it because for me in the medical field has always, whenever there's anything that's remotely criminal, there's always police involved, and I don't have good experiences with the police.
As long as she feels safe and she knows she's not gonna get in any trouble, you can have her speak about a lot. If I was just been able to feel safe and comfortable, I think I would have spoke out.
The moments that you feel like something is off here, or I'm uncomfortable with the answer, I'm uncomfortable with the body language or the look she's giving me as she answers this question, you don't get those when you ask about, are you having nausea or vomiting?
So how do we start screening? You might ask questions like, is the patient comfortable? Attend to their immediate needs, provide clothing if they need it. Is there someone here with you today? Can we talk alone safely? Do you have a place to stay? Who are you living with? Where are you living? Do you feel safe? Has anybody ever hit you or forced you to do something that you don't want to do? An important question to ask is, do you work, live, and sleep in the same place? Have you ever traded anything for sex? Food, shelter, money?
If I was a doctor and I'd be asking questions, my first question would be, are you okay? It seems like a dumb question or just simple, but sometimes it can make you break down and really think about it, because if somebody would ask me if am I okay, I would have actually broke down.
If a healthcare provider asks the right questions in an environment that's not judgmental, and where a message is being communicated that this is being asked to help the individual, in many cases, a victim will be able to disclose what her experience has been.
If a young person does decide to disclose, you're not shocked at everything that they're saying and reacting in the moment, because a young person doesn't take that as, goodness, you need some more training around this issue. They take it as, you're reacting to me, you're disgusted by me, right? You're shocked by what I'm telling you.
The judgmental look is very powerful. It might not be to some people, but it makes you feel very small, very like you're not needed, like you're just disgusting.
It's also important to avoid words that may be stigmatizing, such as prostitute, and to maintain an open manner and a compassionate manner rather than one that's closed and judgmental when talking with these patients. Many of these patients are not in control of their own bodies or their own lives, so it's important to meet them where they are, to receive whatever information they have to give us, and then to receive that information in a non-judgmental manner without disgust, and showing instead compassion and understanding. In doing so, in restoring the humanity to these patients, we stand a better chance of receiving information more quickly that may be of more help to our patients.